Thank you so much, Tegan, and welcome everyone to our Q&A style or information webinar that's all about our certificate programs in Canine Remedial Massage and Canine Hydrotherapy. You may have already been dealing with Tegan. She's been getting the information out there to everyone. She manages the most of the email. We do have some other support team. So you might already have downloaded our information pack and got some great information on the courses, but today is about filling any of the gaps for you. So I'm grateful that you've given up your time and hearing already that people are really dedicated to dogs, which is certainly my passion and why I do this. And just a reminder, if you've just come in, then your questions, pop them into the Q&A, and there's lots of time for us to answer those. Tegan will be going along and answering some in the Q&A for you as you go, but of course there's lots of time for us to have discussion as well. So let's get started. And if you have to leave early, you'll absolutely get a recording, so you don't have to worry about that. So a lot of us here, we can hear looking at this shift. So I'm going to show you how you can make that shift from being you're not necessarily unfulfilled, but how much more fulfilled you can be when you get into something that you really love doing. And not only that you love it, but you get to change the lives of dogs and people every single day. So I can't reinforce enough. We've just run workshops for both of the programs, and just hearing the students being able to say, what they can see about what the owners are reporting, the difference we make in people's lives is enormous. We're saving dogs' legs and lives and extending the bond that people have together with their dog on a day-to-day basis. So I want to be able to share that with you, even if our programs are not for you or not at this time. If you're here, it's because you're a dog lover, and I want to share with you what massage and hydrotherapy can do. So you might already have questions. I could see a couple of them were in there, but as we talk, write down any questions that you have so that you make sure that you can ask them all. So I'm going to share with you what it's like working as a canine therapist on a day-to-day basis, the difference between those two career options, hydrotherapy and massage. And if you're looking at or trying to make a decision about which one I start with, how you may do that. Plenty of people do both. Income and job opportunities in the industry is important for everyone to know, to understand, to make that decision. Details about how we deliver the programs, and then showing you inside, how we use the different platforms and an experience for you of what it's like. So it is a Q&A format. Make sure you ask your questions. You can pop them in there. Sorry, I've written the chat, but into the Q&A as we go along. If you pop them in the chat, we'll check both of them, but the Q&A helps us to track them and make sure we answer all of them. We don't miss any of them. And also intermittently as we go along, I'll open up for Q&A on particular topics, and then at the end. So there's ample time to have your questions answered, certainly. I'm super passionate about the quality of therapists that are out there. I'll talk to you more about that as we go along, but that's why these courses were started, making sure that people that are out there that are delivering services for dogs are at high quality. So these courses aren't for you then if you're looking for like a quick solution, a short course. It is relatively intense, takes you a minimum of 10 months to complete. If you're just focused on building a business from a cost point of view, not for you. We're really looking at, quality. Of course, we want to make sure that our business is profitable, but we need to put in, a lot of work, a lot of effort. We don't have transcripts, so if you don't speak fluent English, it may not be suitable for you. You need to have good access to the internet. So you won't be able to just do it on your phone. You would need to have a laptop or a computer. And you really, it does require a commitment to make sure that you can complete all the content. So saying that doesn't mean that it's difficult. It just means that you need to have a commitment to do it. So I'm going to cover how you choose which course is right for you. The job, career and opportunities will go on to then how the courses are delivered, the pricing of the courses, what it's like to be a canine therapist, and question time. So we're following along in that format, but if you've got any other questions, then certainly just ask as we go along at any time, that's fine. if you haven't met me before, then, who am I to be delivering this to you? Then this is me and my Maximus, one of my Hungarian visualers. And I am, if you haven't already discovered, I'm super passionate about providing as many dogs as possible globally with access to quality rehabilitation services. So hydrotherapy and massage are fitting in under rehabilitation, and making sure that we can deliver the highest quality of services possible to these guys. So a bit about me. I am a qualified human physiotherapist, and when I started my human physiotherapy career, I was really interested in body work or massage. So I put it under that banner of body work. I completed a postgraduate qualification in myofascial trigger point therapy and dry needling. And I used that extensively on my human patients. And I also then worked in a facility where I delivered hydrotherapy on a daily basis. So I really had this experience of hydrotherapy and body treatment being crucial to the outcomes that I was achieving in my patients. And I like to combine both of those together. And I was very happy with what I was doing with people, but I wasn't 100% fulfilled. So this is my first Hungarian visit. This is Toby, and he was he's the one that really stole my heart and took me over towards this, wanting to try and combine my skills as a human physiotherapist with wanting to help dogs. So I got into physio. I was really happy with that, but it wasn't 100% fulfilling. And I really lived for that time with my dogs on the weekend and spending time with my family. And I wanted to have a bigger impact in the world. I've always been entrepreneurial, so I was looking to be able to have a bigger impact than what I was having. And because of Toby, then this is him over here swimming in the pool, this little guy over on the side there. We took Toby to this facility that was an indoor heated dog pool, just swimming for exercise. And there was a sign up on the wall. The lady was offering animal physiotherapy services. I didn't even know that was a thing back then, many, many years ago. And I investigated that and found courses that I could do to go and train as an animal physiotherapist. But then also the business went up for sale, this dog swimming pool. So my husband and Greg and I decided to buy it, and we set up this first canine rehab and hydro clinic in Australia back in 2002. So yes, this is a much younger me. And, my very humble beginnings was in a shed with carpet on the floor, with wet dogs going on it. And then, we moved forward from there. So we designed and had installed the first underwater treadmill for dogs in Australia. Why did we do that? Because back then our Australian dollar was about 55 cents. So importing one from the US was too expensive for us. And we just started this clinic with we got one built here. We started this clinic with the view to trying to increase people's awareness about the importance of rehab. So that was, my humble beginnings many years ago, and I was super determined to make a difference. And a couple of dogs really changed my life. So this is also me with dark hair here, many iterations. So this is me with Nikki. So she's one of the dogs that changed my life. Nikki the Doberman, she ran into a pole and ruptured a disc in her cervical spine in her neck and became paralyzed, and she had a surgery. And at 6 weeks post-surgery, she was still lying on her side, not able to move, and the vet didn't recommend anything. So this was very early, even before we had the underwater treadmill. So it was early 2003. And the owners found us somehow. I think back then we would have been in the yellow pages and some brochures out in vet clinics, before the internet was really doing anything of any significance. And fortunately, they found us, and I used my physiotherapy knowledge to be able to apply it to Nikki. And we did a lot of hydrotherapy in the pool at that point before we had underwater treadmill, and we got her back to running 5Ks a day with her owner. It took 6 months for her to learn to walk, and that was a real eye-opener for me, but also giving the feedback to the vets that we could actually make a difference to dogs that were euthanasia had been recommended because she wasn't getting better. And in a similar fashion to little Rooney here, so this little sausage dog, she was a patient of mine in a specialist clinic that I was working at. She'd had intervertebral disc disease, rupture, and a surgery, a decompressive surgery. She was doubly incontinent, so bladder and bowel, couldn't walk with either of her hind limbs. It's like a spinal cord injury in a person, if you're not familiar with the pathologies. And her owners couldn't manage her, and they decided to euthanize her. And we were fortunate enough that when we offered to take her, then they handed her over to us. So she lived with us. Nikki actually lived with us, the Doberman, for 6 months, and went home on the weekends and lived with us during the week. So I had firsthand experience of how I managed a dog like that. And then I had Rooney after that. And we did have underwater treadmill then. So we did a mixture of physiotherapy exercises, swimming, underwater treadmill, and we got her back to walking as well. And it really showed me that if we didn't give up on these dogs, and there were owners out there that were dedicated to doing whatever was possible, I needed to be able to let people know that it was possible. So of course not for all dogs, but it was possible. So we really, pushed forward to pioneer this industry in Australia, certainly to make a difference and let other people be aware. So these dogs taught me huge lessons. And then going further and further into the industry, as I went out, driving in my car, going to vet clinics, talking to them about rehab, I was really quite shocked, coming from human healthcare, that there was a lack of access to rehab facilities or therapists. So obviously I was just looking in Australia then, but still worldwide and in Australia, we still have the same problem. There aren't enough. It's not like human healthcare where there's access to rehab therapy everywhere. There's still a real lack of access to those services. And vets are not taught about rehab, or they might be taught the theory of it, but they're not taught what to do. So there's a lack of owner education. Owners don't even know this exists. That's very common for us still to hear now when they come into the clinic. I didn't even know something like this existed for dogs. So many dogs suffer and die as a result because euthanasia is recommended for a lot of circumstances where rehab could help them, and it wasn't even offered to the owners. So, over the years then, we're over 22 years now, I've provided treatment to hundreds of thousands of dogs. I feel very fortunate and grateful for that. But also I've tried all sorts of different treatment techniques, and pets and owners often come to us with no hope left. And through trying these and having owners that are willing to make a difference, and commit to the rehab, we've been able to change the lives of hundreds of thousands of dogs, and then save their lives, extend their lives, improve their lives, and deepen that connection between the owner and the dog. And there's nothing more satisfying than being able to do that and see a human so happy to be able to get their companion back. So I was super determined, still am, haven't changed from day dot, probably become even more passionate now with my ability to increase awareness globally, because of what the internet has allowed us to do. I expanded my clinical business. I've worked in all sorts of specialist clinics. We've had several different standalone clinics as we've had to move around with different leases. And we have a very large multidisciplinary canine rehab business in Australia. Now I've educated vets, nurses, physiotherapists in Australia and internationally. I started teaching short courses very early on in my career, teaching short courses to vets, vet nurses in particular, trying to increase awareness, teaching at the Australian Physiotherapy Association, teaching animal physio back then. And in 2017, I founded the Canine Health and Wellbeing Academy. And this was, really with the view to focus on these two areas, hydrotherapy and massage. So I don't teach a rehabilitation certification. I teach massage and hydrotherapy. Other facilities or other bodies, educational bodies, teach rehab and physiotherapy. I don't teach in those areas. And we now have over 500 graduates from our certificate programs in 14 countries, but still, we hear a lot, as some people have already put into the the Q&A for us that there's nothing in their area. So that means our own dogs, if they get an injury or a problem or they're older and have mobility issues, they don't have anything that's going to service their own animals. So, my dad always taught me, don't just follow the path, blaze the trail. And that's what I've always been determined to do and still will. I will stand up and fight for these dogs and owners till the day I die. So choosing the right course for you, it can be confusing out there. I know we have people from different countries, and because Tegan communicates with so many people across the world, we do now have, I've got slides coming up later, we have information about the other countries that we can share with you. But that is the most confusing part, that there can be a lack of regulation, or that there's different regulations across different states, even within a country. So then if owners didn't even know that rehab was available, even if they discover that it's available, trying to work out which place to access, or same for us when we're looking to do a course, trying to work out which course is going to be the right thing for us can be challenging. So we want to make sure then that we're choosing a course that's going to give us what we want. There are people out there that are practicing without adequate qualifications. And the whole canine rehab industry gets a bad reputation because of this. So certainly, vets are one of our main clients, is what we say. We need to look after the vets, communicate well with them. We're trying to work together and not just go and open something up over here without qualifications, because the vets are not happy then. They're looking after the welfare of the animal, which is, paramount, but we need to be working together. So because there have been other people that have opened courses, just done a weekend course, and not working together with the vets, then the whole rehab industry can get a bad name, and then vets just choose not to refer at all. So, if the course is allowing people to work, if there's no regulations and they can work uninsured or not fully experienced, at the end of the day, the worst thing is then the poor service to animals, which is, what we don't want. We want this quality service, and we always want our dogs to be able to access quality services as well. So whether you choose one of ours or someone else's that's closer to you, wherever you live, I don't mind at all. We're here to share information. If you choose ours, it's amazing. And if you choose someone else's, there are other places around the world that also provide great education. You just want to make sure that wherever you choose to do a course, it's an accredited qualification. That means there's going to be minimum standards. It's had to pass through an accreditation process, which is important. You desperately need to ensure that you have insurance, or that the course enables you to get to practice with insurance. And that's one of the things I really reinforce. And any owners, or us as pet owners, if we're going to go and see a therapist, they're making sure that they're insured. So it sounds like a small thing, but if they have insurance, there'll be minimum standards that they have had to achieve in terms of a qualification. So we want to have practical components with live animals in those courses, have educators with appropriate levels of qualifications and specific industry experience. They need to have sufficient and substantial foundational content to build upon. So we don't want someone that's just offering a weekend course, or now, unfortunately, with artificial intelligence, then people are generating courses in short amount of time just using an artificial intelligence. So, look for experienced educators, people that are qualified, and that they're, just because they have a qualification, they need to, have the clinical experience as well to be able to back that up to give you the best level of qualification. And if you can have that community and mentor for ongoing support and education afterwards, it's not just the qualification, but what happens after that. So you get support when you're just starting, and that you can do higher level education afterwards. Once you're out and experienced, you'll have a different lot of questions then, and you can go on to to different levels of education. So if we move along to thinking about massage or hydrotherapy, when we're trying to choose which one we might do, or which one we might do first, we'll talk about now how massage and hydrotherapy help dogs. There we go. So massage or body work, I might use those terms interchangeably. You know, those body treatments are essential for all dogs. You know, in my experience, certainly as a human physiotherapist, then I used a lot of body work on people, and physiotherapists all use different styles of treatment, but I got the best results for people with when I put my hands on them, not just did exercises. And then the same for what I teach in massage is, because there's so much benefit to the dogs. I think that they've been living on the planet for whatever, 3 years, 5 years, 10 years, with just going along with day-to-day exercise or any problems they have in their bodies, and often never had any body work, you know, apart from brushing or the owner giving them a small amount of massage at home. So we know the benefits to the humans, and it makes a huge deal of difference to these dogs. And if they've got any mobility issues and they have to compensate anywhere, then we want to be able to address it. And, you know, the number of dogs now that we have coming in, particularly older, stiff and sore and not moving well, and we treat their body and they're like a new dog, is amazing. And we certainly empower the owners then to continue on massage at home. So there's wide-reaching benefits, not only for the dog, but for the human. It deepens that bond between them. So, you know, every single dog that comes into my clinic for me as a physiotherapist with my physio hat on, I do massage on all of them, but I give all the owners massage to do at home with their dogs as well. So I really love the benefits of massage to the dogs. And then hydrotherapy does something different. So just as important, but different. So in the ideal world, you know, they'd all have everything. They'd have rehab or physio, those things together, hydro, you know, and massage. So if we're going to start somewhere, this can help you work out, you might be adding it on to something, or which one you might start with. So from a rehabilitation point of view now, and any dogs with mobility issues, you know, or injuries, older pets, so they're generally the ones with the mobility issues. So once we get them into the water, we often call it the magic water, because we strengthen and speed recovery faster than any form of rehab. So that is proven with scientific research. And for our oldies, then really prolongs their mobility, so their longevity. Time and time again, we see that. And if we have a patient with a spinal injury from a variety of different forms, then the hydrotherapy is vital for their gait re-education. So there's huge amounts of difference that can be made to dogs with the hydrotherapy that we cannot do with land-based exercise. So, you know, if we were going to choose one thing from a rehab point of view, it would be hydrotherapy. And then from a pain management point of view, then the massage. And, you know, intermittently here, I've got little dog stories in here, which just helps you get an idea of what we can do for these doggies. So Gemma is a Maremma, and Gemma had a congenital abnormality, so something she was born with, some cysts within her spinal cord, which meant that she had like a partial paraplegic for a person. She had spinal cord injury that meant her hind limbs were a bit wobbly right from a young Maremma. And intermittently, she would have times where she couldn't walk at all. So it would flare up and down. She had a combination of hydrotherapy, where we had the environment where we could strengthen what her current problems were, and she would have regular body work with me as well to manage her compensation. And we would always have an up-leveling in her mobility, which the vets didn't have anything else to offer. So, you know, well-meaning vets providing all the treatment care that they can, but then there's nothing else that they have. And through the combination of both of those therapies, then we could lengthen her life. So if she stopped walking, you know, which she did, then for a large breed dog, there aren't a lot of options for the owner to be able to help them. You know, we can put them into a wheel cart, of course. We could put her into hydro and she would have a burst back up and mobilize again, treat her body, and she would mobilize again. And Jack, who I saw him as a young dog with elbow dysplasia, he had surgery for that, and he came to me for rehab in the hydrotherapy. So we rehabbed him back to normal function, and then he lived a long, happy life until, unfortunately, he got out of his property and was hit by a car. And then he injured both of his back legs, and one of the knee joints, the stifle, had a global instability, meaning it was just flapping around in the breeze, and the surgeon did a great job of repairing it, but he did not want to use that leg. And fortunately, his owner had the experience of rehab as a younger dog for him. So she came back and saw us, and we were able to get him to use that leg with a combination of massage to the compensatory areas and getting him into the hydrotherapy is where we could start to get him to weight bear. So we saved his leg because euthanasia had been recommended for him, and because we saved his leg, and then he had 3 limbs with osteoarthritis, and we were able to extend his life. So right up to the end of his life, he died from renal failure, from kidney failure. We could continue to keep him moving. He was quite lame towards the end of his life, but he would come in and have regular body work with me. So these, are dogs that are really touching to me, because I know that I contributed to keeping them together with their owners for a long period of time. So how about you thinking about that? Maybe power is not the right word, but you have it in your hands then to be able to reduce the dog's pain and suffering, extend their life, save their limbs and save their lives. And it's pretty rewarding to be able to do this. So thinking, are you ready to make this your career? Is there something getting in your way? What are you telling yourself? Are you telling yourself, I can't do it? I don't have the experience. I don't have the time, etc., etc. I'm going to talk to you about some of the little thoughts that might be coming up in your head, but certainly, pop anything into the Q&A that you want to share. So job opportunities and income to help you work out, if I did the qualification, what does that mean for me after that? So the state of the industry in the whole world, dogs are now VIPs or VIDs, very important dogs. We're really VIPs in the family. If, I'm sure only if you're on social media, but or TikTok, you're scrolling through, even YouTube, looking at cute dog pictures, reels, stories. Like, we can get lost in that forever. We're all dog lovers, and seeing what's available now out there and what people are doing with their dogs, we know more than ever. And there are regulatory bodies or government bodies that do surveys looking at pet ownership. We know what people are spending out of their what family income on dogs. What they're willing to do shows us that they're not just what we're seeing on the internet. It's showing us that dogs are more important than ever in the family, and other animals, but we're talking specifically about dogs here. And there's so many dogs out there going without treatment that they need, and for lots of different reasons. The owners want to do everything they can for these dogs. They're spending more of their income on veterinary surgeries and treatments and doing all the things that they can, but the lack of aftercare that's there is still a problem for them. So there is a massive gap in the service that is offered to these patients. And it's not just that the owners can't afford to do it, it's that they didn't know that it was there. We're just seeing this time and time again, that people don't have an education about what else could be done, so they can't make an informed decision, or that they know that they want it and they can't access it because there's nothing in their area. So, really it's that disappointing thing to me, is that there's a real lack of canine therapy services available for pet owners. And then depending on where we are in the world, then that includes us and our own dogs. And that's really frightening. If we wanting to, help other people's dogs as a career, amazing, but certainly first and foremost, our own dogs. We want to extend their life. We want to live with them the longest possible time. We want to make sure they're happy and pain-free. Trying to access these services can be a challenge. We have people that travel 2 hours each way once a week to come to our clinic for therapies, which is really sad. We need to, make it more accessible for more owners. So thinking about starting your own business from a hydro point of view, and then I'll talk about massage. If you are wanting to start your own business, then you will need some type of a facility to have your hydrotherapy in. Whether you buy a building, whether you lease one, whether you do it on your own property at home. We have several people that do that have set it up on their own property, like in a garage or in a purpose-built shed or building. You'll need to calculate all your costings. It's really going to depend on your location, but a hydrotherapy business setup is going to be much more expensive than a massage one. Just as an average, so you can do some sums, an average treadmill session when an owner comes and pays for an underwater treadmill session is $80 booked in a 30-minute slot. So that would be sort of middle of the road across the industry. It's going to vary, but that would be stock standard in Australia I'm talking about. So just as an example, make sure you do your own sums, talk to your accountant or CPA. A hydrotherapy unit can cost around $55,000. I know, this is Australian price, so the US might be significantly cheaper, but this is 55,000 Australian. So I just put in an estimate of, if you're having a loan for that, $1,250 a month as an example, your rent, $2,000 a month. So just work out what it is for you wherever you're looking at renting, if you're having to rent, and utilities, $400 a month. So just as a basic for you to set that up, apart from setting up a whole facility, for you to break even, which means, when the income that you come in covers all your costs, at $3,650 a month. If we charged $80 per session, then 12 sessions of underwater treadmill per week you would need to do to break even, and that means you haven't been paid yet. So you would need to think about, could I get more business than that? And also encouraging you to explore other products and services that you could offer for additional revenue. So some people do it alongside grooming, or in their vet clinic, or they're a dog trainer as well, and they combine those things together. And that's what Kelly did. So Kelly from Happy Cats, a cattery, and Hands for Paws Pet Therapy. She has a cattery and cat grooming business, and she did the qualification, installed hydrotherapy to offer additional services for pets in her region. She's out rurally. So she already had an income stream coming in, and then she added the hydrotherapy in because she was passionate about helping dogs. We're going to talking about a massage business now. If you're going to start your own massage business, you might have a mobile business, you have minimal equipment and setup required. So you're going to need to have, some minor equipment in terms of, you might have yoga mats, towels, your iPad or laptop. Much smaller amount of equipment is going to be required for massage. You need to consider your travel fees versus travel costs. So you might say, here, if I'm doing a mobile business, if I travel within a 15-kilometer radius, it's this price, or if I go further than that, it's this price. Or you could also, of course, set up a massage business in your own house, in a room in the house, in your garage, with much lower startup fees than what you would do for a hydrotherapy business. So this is Charlene. Charlene graduated from our Canine Remedial Massage course. So Charlene started as a human nurse, and then she started a business doing training, with NADAC agility. So she was doing pet care and pet training in agility and dog walking, and then she added in a massage service. So she set up a business at home as well as doing massage out mobile, from a mobile point of view. So she started with an existing business with dogs and added the massage into it. And you definitely do not have to start your own business. So that can be scary for some people. They don't want to do that. And certainly you don't need to. There are more and more facilities that are hiring people for hydrotherapy. That's what I do in my business. And all my hydrotherapists, come into our facility that have gone through the program. And if you're working for someone else, vets and rehab therapists are putting in hydrotherapy services. So that's a good place to look, as well as other people that have already set up their hydrotherapy businesses that might have come through our programs. Then they'll be looking for future hydrotherapists as well. And then grooming salons, pet resorts, rescue organisations, there's other places that are putting hydrotherapy in. clinics are opening up all over the world as the owners demand the services. So there still is they're not fully serviced across the world, of course, but more and more clinics are opening, which is great. From a wage point of view, for you to do a calculation, then the average wage in Australia would be about $30 to $40 per hour, depending on where you worked. And for massage, working for someone else, same thing. Rehab centres and physiotherapists are looking for massage therapists to operate within their clinics. So we have massage operating within our clinic, and groomers, pet resorts, rescue organisations. There's a lot of other places that are looking to employ massage therapists now, and average wage, again, if you're working on an hourly rate, is going to be about that $30 to $40 per hour in Australia. Or you might work as a contractor, and I've just said as a rough average, it's going to be very varied depending on where you're working, but a contractor commonly takes home about 50% of their takings, so it just depends on the arrangement that you had. You know, on the back of that, contractor versus, you know, you having your own business, you could go and offer for a vet clinic for you to set up within their clinic. So you're working as a mobile massage therapist, but if you're seeing all my patients on a Thursday afternoon at the veterinary clinic, that's what would happen from a contractor point of view. Then you might be paying a percentage of what you turn over to the vet to lease the space, or in any of the other places. So that's very varied, and, you know, really depends on, from a job point of view, where you're working and what the owner of the business wants to do. And I just put the calculation for you there. If you're thinking about the percentage of takings, an average massage per hour would generally cost somewhere between $80 and $120 per hour. Again, very varied, but, you know, that would be the average. So thinking about, will I be able to earn a living? Some people come from corporate, you know, or a different career, and they go, I'd really love to do this as a career, but I won't be able to make a living. It's not the same money that I'm already receiving. Completely fine. Then you could do it part-time. So, you know, it's thinking about, what do you want to do to, you know, have a career that you're really loving? And if you have certain financial commitments and you needed to work over here to do that, and this, you love doing it, but it's not giving you the money that you would like to have, particularly if you're employed, then you could consider doing it part-time, certainly. And if you have your own business, absolutely, you know, you'll have to work at growing a business like you will with any business. You know, like me, I'm going to continue to work and do what I can to grow industry awareness, and also make sure that I have a profitable business. And there are definitely graduates in the program that are out there with successful businesses and earning more than what they did before in their job. So, you know, but if you're running your own business, then that's not a small feat. So you can become a qualified canine therapist if you would love to spend all day long working with dogs, and you have a strong desire to help them live a long, happy, healthy life, and you're willing to put in the work then to learn all there is about the canine anatomy, pathologies, and treatments. We can absolutely support you to do that. So I'll just stop here and see if Tegan wants to ask me anything, or if I continue to move forward.
Sorry, was busy typing away. I think we're good for the moment. Yeah.
Okay. Super. So just looking at how I set up the courses, inside the courses, each program has 6 essential elements. So these are not the named modules. This is the elements. This is the areas of learning that we go over. And each of these essential elements builds on the next one. So it's a stepping stone. We need to do this one before we go on to the next one. And I'll talk about each of these individually. So we need a clear understanding of anatomy to be able to perform an effective treatment, and then select a correct treatment. Perform an effective assessment. I can't remember if I said assessment or treatment then, but we need to do a good assessment to be able to choose the right treatment that we want to do. And if we don't have a good knowledge of anatomy, then we can't do that. So we cover the topographical anatomy, which is the anatomy on the outside of the dog that we can feel, which is important for our palpation or what we're feeling, to look for, is there any muscle soreness, or is there any muscles that are smaller than others? So we need to be able to know what we're feeling. We also talk about deeper layered anatomy, particularly from a massage therapist point of view. Assessment is different for those two courses. The massage therapists go much more in depth into deeper layered anatomy and soft tissue palpation, the systems of the body, so how the dog all works together from its systems, the skeleton, the joints, the muscular and the fascial systems, or those two are intertwined. So the soft tissues, we can call them collectively, and the nervous system. We talk about then the pathologies. So we've learned all our anatomy. Now we talk about the pathologies, the common pathologies that dogs the dogs that come into our services will have. So orthopedic and musculoskeletal pathologies, neurological pathologies, both surgical and non-surgical. So we go through a lot of different pathologies in both the courses, how the dogs would present with those, and then we go on to choosing particular treatments based on those. So you can't perform an effective treatment without a thorough assessment. The assessment is an extensive area in the course, both theory and practical. And because we had to, when we went into virtual classroom, then we developed innovative ways to teach assessment and make it much easier for you to learn. So with all different camera angles and things that we can draw on dog bodies, and really making it easier for you to think about how you're going to perform a great assessment. And that's the basis for us for then treatment selection. So once we've performed a great assessment, then we can think about what treatments we're going to do. So we cover the theoretical components of hydrotherapy or massage as the background, and then specific treatments for different types of pathologies with lots of different cases presented. And to start you off, protocols for all different pathologies. So when you're starting, then it gives you a starting guide as to when a dog has this, we look for this, treat here, make sure you do this. And then as you become more experienced, then you start to have your own pattern recognition and clinical reasoning, it's called. So you're thinking about what you're doing. But to start with, it's like a new graduate for me as a new graduate physiotherapist, for instance, just an example, or a new graduate vet, think of that, or a new graduate doctor. They come out and they don't just know everything and off they go. There's protocols for them to follow. They can go back and look in their books, and then they have mentors to help guide them. So we have the protocols at least so you can get started. And then if you're thinking of starting your own business, then there's lots of guidelines presented and talking about marketing and communicating with vets. So that's for everyone, whether you've started your own business or employed. Copy for website and brochures if you're looking to do that. And there's a private community for ongoing support after you graduate. So when you graduate, you go over into an alumni community where there's all the graduates in there, where we can discuss cases, and you can get feedback and ask for assistance in a supportive community. So as I mentioned before, we open for enrollment generally twice, sometimes 1 to 2 times a year. Just we move the timelines around, but we're currently open for enrollment, and this course starts on August the 19th of 2024. So everybody starts together. The study load is an average of 5 to 7 hours per week. There are some modules that are larger, but we'll tell you about those, in beforehand in advance. New modules are released every 2 weeks, and each module has an assignment for it. So most are multiple choice assignments, and they're open book. So we're never trying to trick you. I'm trying to teach you concepts that build on concepts, is what I say. So you watch the material there that you have lifetime access to, and you answer the questions. And we talk about different things for retention of knowledge, and then that builds again on the next module. So the next module, use the module before to help build on that till you start to get through to the assessment and the treatments of the animals. There are some practical video assignments with personalized feedback. So you need to video yourself doing different things that are sent in and individually marked with your feedback to help keep you on track and to answer any questions that you have. We do regular live Q&As. So the Q&As are recorded. We vary the times around to try and cover all time zones, but most of us have busy lives. So you can still submit your questions. I will answer them even if you're not there live. And then you have access to those recordings. There's a live interactive 3-day virtual workshop. So that's what I was talking about, that we've just finished, running those for previous intake. That's a great time of year where, there's lots of interaction. You have your own dog, you learn lots of different things. You see dogs, having assessments and treatments. Plus, there's many cases provided by the Academy for you to look at throughout the course modules. From an examination point of view, the final exams, there's a theory and a practical exam. So the practical one is over Zoom, and which is an open book again, and you have to video yourself doing different assessments in your theory part as well and submit that. And then there's an optional in-person placement at Canine Health and Wellbeing Academy partner clinics, which I'll talk about a bit further in the slides. So some student feedback just to help you, because you'll have different questions and all different backgrounds, and probably this is a good slide for me to reinforce that. Even though I could see there were people in here that are coming in that already have a human healthcare or an animal healthcare qualification, there are no prerequisites. So you don't have to come in with a prerequisite. There's no expected prior learning. That is who the course is targeted at. So Kim, who's a dual qualified, so she's completed both the Canine Hydrotherapy and Massage Therapy qualification. Kim said, I enjoyed the level of detail in the course. I was concerned about how in-depth it would be because no prerequisites were required. So that means, no prior study. I was surprised at the extensive amount of real experience and knowledge that was passed on to the students. I have many rehab textbooks that discuss hydrotherapy, and none of them come close to the amount of information that was provided to us in this course. I was really happy about that. I think it's the best course available just based on the amount of experience and knowledge that was provided in the course. Michelle's years of experience and knowledge that were passed on to us was invaluable. It wasn't just theory from some textbook, it was years and years of trial and error and experience. That's where the value was. So we will talk about different parts of the world that you're in and whether the qualification is currently recognised in your country. And Tegan and the support team continue to work solidly on this and communicating with other regulating bodies, so then we can make sure that our qualifications are recognised in as many different countries as possible. This is countries we currently have students in and graduates from. So we're now global. So then there's more recognition, and again, continuing to, work with those regulating bodies to help us out. So just as some basic knowledge for some of the countries, Tegan is well versed in this. So if you have particular questions, then please pop them into the Q&A. And while she's madly typing, if your question didn't get answered 100% about your area, then you can communicate via email, or you can talk to us at the end in the Q&A as well. So in Australia, we're recognised nationally and accredited by the Australian Canine Rehab Association. In New Zealand, the courses are recognised nationally and accepted by the NZACH. In the USA, we're an internationally approved education provider by the IAAMB. You can go to their website and then you can check with state laws for your individual state to confirm you can practice once qualified, but they have a list of all the different states. And Tegan has a lot of information on different states within the USA as well. Canada and other countries, we recommend checking with the regulatory body in your country and state, because they have different regulations, and some don't have any at all, which can be the case across many places in the world. Hong Kong, Singapore and Malaysia, recognised by authorities and insurance companies. So, the team have done a lot of work with communicating with different bodies, and if you need particular information, then please reach out for that. The prices for our 2024 certificate courses, if you haven't seen them already, so these are Australian prices in AUD. You can either pay a single payment of $7,499, or you can pay over 9 months. So they're $879 of a monthly payment that's set up in a direct debit, and you get the same course whether you're paying a single payment or the monthly payments. You've got longer to pay it off. And you've got a little bit extra to pay than when you're paying the monthly payments. So hydrotherapy, massage is the same price. And just from a comparison for our USA people, I know it looks sad for us in Australia because it looks significantly cheaper than this is the American price. And for the Americans, it looks very expensive in Australia, but it's our exchange rate. So just if you're from America, then these are your they're your payment options. So I think, I don't know if I have that correct actually. So no, I do, pardon me. So the massage is the same, 7,499 or 879. And then in our US prices is 4,995 or 590 for the 9 monthly payments. So all the online course is delivered with 19 modules, your virtual 3-day workshop, all your practical assignments and feedback, a recognised certification, our 5-star support team, an in-person clinical placement is all included in those prices. I'm just another little guy for, that made a big difference in my life, but seeing what we're able to do. So this is little Dexter. He had, similar to my Rooney, surgery for intervertebral disc disease, and he couldn't walk at 5 weeks post-surgery. Then he had no motor function or no movement in his hind limbs, and he was incontinent of his bladder and bowel. And the owner came to me and said, if you can't make my dog walk, then I'm going to go next door to the specialist clinic and euthanize him, because that's what they have recommended. So I can't guarantee that on the day, but I could say through the clinical experience then that we've seen lots of dogs like this, including my own dog, that we can get back to walking. So while I can't guarantee it, it's worth trying rehab and seeing whether we can make a difference. And that's what we did. So, we got him back to walking and living a long, happy life. He ended up, even once he was walking, coming and having body work with me every month with his dedicated owner. So we saved his life. It really makes a difference. If you're interested in the dual qualification, which means completing both of the courses, you can complete them together. So we have several people that want to do that. They purchase and complete both of them at the same time, just so that you understand, or you could do one and then the other. And so you understand the first 11 foundational modules are the same in the course. So you don't have to repeat those. You do them, and unless it was like, 5 years down the track where you would need to make sure that you had some clinical experience during that time, but you would complete those first foundational modules once, and then you'll need to go out and do the massage and the hydrotherapy component. So if you choose to do those at the same time, then your workload is going to double once you get to module 12. So it's just being aware of that. Both the courses begin on the 19th of August, and you get a discount for the second course because you've already completed the 11 modules at the start. So Tegan can share that information or email her. She'll be able to help you out with that. You have to attend both of the workshops, and all those packages and the pricing for those is on the webpage for enrollment, and we can send you links for that as well. So the in-clinic placement, we've now set up partner clinics in different places throughout the world, and they're expanding over time. So this is included in your course pricing, and it's optional. So there's people already that are out there working and don't want to go and do a clinical placement, which is why it's optional. They don't want to travel to a place to do that. And if you've passed all the components, then you don't have to do it. So you receive your qualification, and then the in-clinic placement is after. So particularly for people that want to do the hands-on component, you get to see the live cases. It follows a structured criteria and assessment process. And this is, separate to masterclasses that I offer or advanced courses. So this is just an optional component that's included as we set those partner clinics up around the world. So if you're thinking, I'm not sure if I can afford it right now on that pricing, completely great. We don't want you to overcommit. It is designed to be done alongside a full-time job, so you're not having to give up work in order to complete the qualification. You can pay on the monthly installments, but you want to make sure that you don't overcommit, so you don't scrape together the money to just be able to get by, and then you put yourself into a pickle. So if it's not for you now, might be for you down the track, but just make sure that you think about that specifically. But yes, can be done alongside a full-time job. Many people do that, and then start doing some treatment part-time. So you don't want to be overcommitted. We want to make sure that you can graduate out the other end. It can feel like there's never a perfect time. However, we can be nervous about it. Can I do it? Just think about, you'll be qualified by June next year, and then you'd be able to go out and start practicing. And think about where you want to be this time next year. You are worth the investment, absolutely. And so are the dogs. The number of dogs' lives and humans I've been able to change is amazing. And we have a successful business, but that's because where all of our team are dedicated to doing that. So there's no magic around that from the Dogs in Motion clinic point of view. We go in, we give dedicated care to the owners. We've developed our reputation because of the service and care that we deliver, and through that then we have a business that's successful. But I've gone out there and talked to vets and continued to promote rehab. So we don't just sit here and open the doors and, wait for the clients to come in. That's like any business. That's not going to happen. You need to go out and do the work. You need to be as passionate as me to stand up for these dogs and owners and say, hey, these guys need to have treatment, and I've got the treatment here. So if we get vets that say, oh, I don't believe in this, so we hear this from time to time, I've opened up my clinic and nobody's coming in. Well, you've got to keep going out there and talking to people, being brave, pushing outside your comfort zone to educate the general public as well as the vets that, these facilities and the services are really required. And you really deserve to have that rewarding career, being able to change a life for someone and their dog. There's no words for it. So you might also be thinking, can I do this without prior experience? And reminding you that there are no prerequisites, so you don't have to come in with the prerequisites. Of course, if you have them, great, you can add those skills into it, but it is designed for people with no prior experience. I've been teaching this for a long period of time. We have people with all sorts of backgrounds that have come across with no prior industry experience and have gone out and, and now having an amazing, rewarding career. You don't have to learn a whole bunch of material. It's open book for you. It is thinking about, again, I have these innovative ways of teaching, and concepts are built on concepts so that you can get out there. I want you to be successful. I want you to graduate. And we have many successful graduates out the other end. Saying that, not every single person will pass. If you don't put the work in, then you're not going to pass. So we're not just running a flippant course and taking everyone through willy-nilly. So this is Alison. So Alison came from an admin background in her previous life or career, no prior study in anatomy or vet nursing. She just loved dogs. She was a client of ours with her own little doggy and really thought that this was something she wanted to do. So she completed the Canine Hydrotherapy certification, and she is now the manager of hydrotherapy in my clinic. So that love of dogs and dedication, she's dedicated to service. She's an amazing team member and teaches in the hydrotherapy workshop with me. I think we're 6 years since that, started. So, if you have the willpower, you absolutely can do it. So some more feedback from our students. This is Beverly. So she's a certified canine massage therapist. I loved all of the course. I just want to know more now. Michelle is amazing, a master teacher and inspiring role model. I'm so glad I trusted myself about taking this course, as it has been so worthwhile. A massive thank you. Thank you also for taking the time to answer all of my questions, which our amazing 5-star student support do. Very dedicated, There's global student support team covering different time zones because we have students all around and graduates all around the world. We have live regular interactive Q&A sessions where you can get questions answered live if you want to do that. Private Facebook groups, each for the separate courses, so that you can have students answered in there. The interactive virtual workshop, individual customized feedback. So when you're submitting your video of you doing different techniques that we ask you to, then you get individualized feedback for that. And we have an optional study buddy program for people that are wanting that. So all the feedback that people give us, we continue to upgrade and change our course depending on what people are requesting. So the study buddy program was started at the request of students. So the student support is amazing and really helps you get through and feel like you're part of a community. So Karen, who is a certified canine massage therapist, her feedback is the course is very comprehensive and in-depth. It is very complete and the structure it uses builds knowledge systematically. Instructions are clear and the use of technology for sending the tests and being able to review them was excellent. The support team was great for any questions or clarification on processes and always a prompt and friendly reply. This accessibility was a real positive experience and gave me confidence in the course procedures. And it is important if you're not super tech savvy, then it can seem overwhelming to go in, or you haven't done a lot of online courses and use a platform. And there's lots of guidance and support to help you do that. You might be thinking, is it too hard for me? I haven't studied anatomy before. And again, no prerequisites are required. We have people that have come from all different backgrounds. So, corporate or, nothing to do with any sort of anatomy, physiology. And I teach those concepts built on concepts. So you don't have to remember it all. You have resources that you can go back to. There's lots of people that have come through before you, some that haven't studied for over 30 years, and they are able to go through and graduate. So the support is there, and the way that I teach it, it makes it achievable, and you're able to take it on board. Otherwise, we wouldn't get the graduates coming out the other end. So I think it's really structured in a way that doesn't matter whether you've studied anatomy before, you can certainly get through it. So Emily, who's a certified canine massage therapist, she said, my only concern when I started was if I was smart enough to understand and take in all of the content, but that was definitely not a problem as everything is explained well and in detail, as well as having multiple opportunities through the support team or the live Q&As to get a better understanding of anything I was unsure about. I love the whole course. I love that everyone was very welcoming, patient and understanding with us as students. The fact that you could tell everyone involved had a genuine interest in helping animals made it a whole lot better as well. And absolutely they do. Nobody's going to be here if they don't love animals. You might also be thinking, I don't have the time right now, and it's important. Again, we don't want you to overcommit yourself. It is about 5 to 7 hours per week. So that's going to vary depending on student, of course. So it offers flexibility to fit around your other commitments. And a reminder again that each module builds on the next one. All the assignments and exams are open book, so you're not required to remember large volumes of information. And there are many different resources that I develop and we provide to you to assist in your learning. So as students ask questions about something, I like to create something else to fill that gap. So, we continue to provide and update resources for you as we go along. So more student feedback from Hannah, certified canine hydrotherapist. So when I started the course, I was worried if I would have enough time to study as well as working full time. However, I loved the course so much that I always found time to complete it. The content of the course was extremely good. There was a lot of information. It was easy to remember everything. The support team always answered any questions and emails promptly. In the virtual workshop, I love seeing how the clinic runs and what it was really like as a hydrotherapist. And then Sarah Jane, who's dual qualified in New Zealand. She has a background in business, accounting, and naturopathy. And her heart was always with dogs and natural healing, but she never thought she could combine the two into a career. bit like me. She has now graduated with both qualifications and has set up her business offering canine massage, hydrotherapy, laser and bark flower remedies to dogs in need in Auckland. And what a beautiful picture. So you might be thinking, how is it done virtually? And we have all sorts of different ways and different, camera techniques that we use to be able to show you how we do different assessments and treatments virtually. So all those foundation theory modules are completed online prior to any of the practical modules. You also then have practical assignments throughout. So the video assignments with your individualized feedback, the practical during the workshop. So you need to bring your own dog. We put you on the camera and get you to show us different bits and pieces. So we're watching all the people and their dogs, up on the screen. And we have a lot of practical cases where you're watching us work up and provide treatment to cases. There's a practical exam, so there's a theory component, but also you have to bring a dog to the practical exam, which is conducted on Zoom at an appropriate time for you. And we give you a case scenario and you have to show us what you're going to do on the dog. So there's a lot of ways that we can work virtually these days and enable people to still gain a qualification and not have to travel all the way to Australia. Actually, and that from a virtual point of view, because you just got the camera viewpoint, then you're seeing a lot more cases. We can flick through a whole bunch of different cases more virtually than what we can do in a live teaching. But if you really want the placement and that experience, then we have that available for you as well. And we have over 200 graduates in the last 3 years that have all been done virtually. So certainly, again, we're very strict on the standard of student that comes through. So it is absolutely possible. We have little sneaky innovative teaching techniques that we use as well to help you learn virtually. So Kim, who is also dual qualified massage and hydrotherapist, she said the online practicals worked out better than I expected. I loved that you had a really good view of the dogs in the treadmill and also a good view of what was going on when Michelle was doing any demonstrations. The lecture slides and videos were well done. The additional handouts that were often provided were very helpful. The Q&As were great as well. I also learned a lot from attending those sessions. And lovely Jennifer, she's dual qualified as well in the USA. So she came from a corporate background, having experienced the benefits of hydrotherapy with her 2 Labrador retrievers. Jennifer volunteered at a hydro clinic for 3 days prior to signing up for both courses. So that can often be the case for us. We've had the experience for our own dogs, or we've gone in and volunteered or gone to see what it looks like, and then we want a taste of it ourselves. She has now graduated and has opened her very own canine hydro and massage clinic in Oregon. So global global qualification and global graduates now is really important for me, that we're being able to offer services to dogs all across the world. So what is it like to be a canine therapist on a daily basis? We're surrounded by dogs all day long. So this can be our consult with me providing massage to one burner, and the other 2 burners in the family come along as well. We get to be a part of their recovery and return to function. We save dogs' lives when we're told that they could be euthanized. We see the appreciation in the dog's eyes. These are all got happy smiles on here, including me, when we're part of a growth industry, which is so rewarding. We're making a huge amount of difference. So really great job satisfaction. However, it can be demanding. It is a very physical job, so you do have to be fit and keep yourself fit and flexible. So if you had significant arthritis in your knees or your back, you will struggle with this. It is physical for both of them. We're moving, bending, lifting. Think about healthcare within a human hospital, a busy hospital, same thing. You're moving, bending, lifting. Dogs are unpredictable, so we're moving in different ways. So if you're working in hydrotherapy, you're going to get wet as well. So wet feet, wet hands, chlorine. You just have to think about those things that are going to be demanding for you. Massage can be, demanding you down on the floor for a lot of the time. that you're doing body treatments, and it can be emotionally hard at times, particularly, you know, when a client and their dog are no longer with us for a variety of different reasons. You have to complete a lot of paperwork. There's a lot of admin. If you choose to run your own business, you'll have all that accounting and business admin and responsibilities as well. But the benefits are huge. The rewards are huge. So just checking if there's any questions at the moment. I know Tegan's madly typing, so I might just keep moving on, and then we've got a big bit of question time at the end if required. So having a look inside so you can see what the modules are. So what's covered in the hydrotherapy, an introduction to hydrotherapy for the canine patient, the physical properties of water, so how the water is going to change your body when it's immersed, the principles of canine hydrotherapy. We discuss primarily underwater treadmill, but also swimming, because underwater treadmill is much better from a rehabilitation point of view. Canine skeletal anatomy, so the anatomy of the skeleton, the muscular system, the nervous system, common pathologies requiring hydrotherapy, assessment of the canine patient, hydrotherapy for rehabilitation, for health and fitness, how we develop and progress treatment plans in hydrotherapy, working safely in canine hydrotherapy, use of different types of equipment, the practical delivery, how we're going to do the day-to-day, the water chemistry and how we look after the sanitization, working as part of a multidisciplinary team, and the business development and hydrotherapy facility design. And then massage is similar with those introductory modules in anatomy, introduction to massage for the canine patient, assessment for the canine massage patient, the pathologies that are commonly presented to us for massage, the foundation massage techniques, and then massage treatment for well-being, for sporting dogs, for specific types of pathologies, for older pets, how we keep ourselves working safely in the canine remedial massage environment, working as a mobile massage therapist versus if you want to start up a business or design a facility, development of and progression of treatment plans in massage, and working as part of a multidisciplinary team. So we use Kajabi as our platform. So if you purchase, you log into the course platform, and then your course content is here and it rolls through. It gives you a little tick when you've completed a module, and the modules, as they're released, new ones open up for you, and then you have lifetime access to that, so that if you're a dual enrolled in both courses, you'll have one in your library of canine hydrotherapy, and then you'll have one in canine remedial massage as well. So you would have two different programs. All the webinar recordings are kept in there. All the information is kept in the one place. So the only other place we have is the Facebook group, but all the information, if you choose not to be on Facebook, all the other information is, emailed to you. There's a schedule page. So all the links, everything is housed within Kajabi. You can use Kajabi on your phone, at least to find where different bits and pieces are, but the recommendation from learning anatomy in particular and being able to see videos and stuff is going to be tricky on your phone. We use the Easy Anatomy app. So this is a great 3D app where we can take off layers of the dog and turn it around, and little quizzes and things inside there. So that's been the best app that I've found for learning the canine anatomy. There's lots of videos of me demonstrating where things are, on the dog skeleton versus the dog. So, you've got that. We do that together in practicals as well, but we have it in the lecture. So, you can go back and refer to that at any time. There's in posture and conformation section, then we talk about how certain dogs are put together. So we talk about when we're looking at a dog, what we're seeing, where are they transferring their weight, what does that mean for the dog. So all sorts of different postures are described and discussed. We talk about different breeds. So the most variation within a species of dog. So these are two just normal, a normal sausage, a normal Dachshund, and a normal French Bulldog, different conformation, different breeds, what might mean for them in terms of hydro and massage, but also what it might mean for them in terms of pathologies based on how we put together. So we go through a whole bunch of different breeds. We go through gait assessment, so walking assessment, how we might analyze that. So this guy's got a prosthesis, an artificial limb on his left hind limb. So we look at all different gait assessments, different treatments. So we've got great views of inside the treadmill, and same for massage, how dogs are going to be moving, me doing a different assessments and treatments of dogs for massage. In the massage, then this is a slide taken from the protocols. So if we've got a dog that's got a problem here, make sure you look here, here, and here for your assessment and treatment. So these are the protocols that are going to be guiding you. So just some sneak peeks of what the information looks like inside. So some more feedback from Angela, who's dual qualified in Australia. So Angela said the course platform was so easy to navigate. The support and assistance throughout were exceptional. The Q&A sessions were an amazing opportunity to learn directly from Michelle. And the workshop was so valuable for bringing together the theory and practical, especially with such a variety of canine what are the voices saying in your head? Is there anything that's keeping you stuck, thinking about whether you could do it or not? Now's your opportunity. Think about how your life could be different in a year from now once you've graduated, and all the different doggos that you get to spend your life with. So if you want to email us a question specifically that you don't want to put here, or you've had to leave and you're watching the recording, then you can email further questions at info@caninehealthacademy.com, and you can book a call to talk to one of the team if you want to as well. And we'll send you all this information via email as well. If you don't have the ability to take this down, you don't have to remember it. We can email this information over to you too. So thank you, everyone. We look forward to answering any questions that you have, if you have any further ones, or joining you inside the program if we're fortunate enough to have you choose us. And even if we're not, thank you for your time, for your dedication to wanting to help as many dogs as possible live long, happy and healthy lives and spend more time with their humans. And yeah, anything we can do to help you, then please reach out. Thank you, everyone, and bye for now.